Yasmin, everything looks great. The ultrasound is normal. The baby is in a normal position. Have you begun to thought about what type of birthing options that you're going to use for your baby?
I really haven't researched much about it. I'm not sure.
Okay. Well, I can tell you about a few things. I'm an obstetrician, so what I specialize in is pathology and high-risk pregnancies and surgeries such as cesarean sections. For you, you are very healthy, your history is good, and you're very low-risk pregnancy, so you could consider a midwife. Have you heard anything about midwives?
I've heard they're all quacks.
Well, I can actually clear up a few of those myths for you if you'd like.
I would like.
Myth: having a baby is so expensive. Fact: Americans could save $13 billion to $20 billion annually by developing a network of midwifery, demedicalizing childbirth, and promoting breastfeeding.
Myth: having a midwife is not as safe as having a doctor. Fact: midwife patients have lower use of forceps, vacuum extractions, infections, cesarean sections, and babies requiring resuscitation after birth.
Myth: if I have a midwife, I can't have any pain medication. Fact: midwives are allowed to prescribe medication when requested by the patient, and they teach about the risks and benefits involved.
Myth: if I use a midwife, I have to have my baby at home. Fact: while that's an option, 97% of midwife births are in the hospital or birthing centers.
Myth: medical procedures are necessary for a safe birth. Fact: obstetricians are taught to actively intervene in labors by giving oxytocin or an epidural pain management. Midwives only intervene when necessary.
Myth: the use of midwifery is not prevalent today. Fact: midwives attend 70% of all births in Europe and Japan. In the United States, they attend less than 8%.
Myth: no one has a midwife these days, and medical professionals don't recommend it. Fact: the World Health Organization says that the preferred location for most births is outside of the hospital, in the home, or in a birthing center.
So, I gave you a few things to think about. Does that clear some things up for you?
That helps a lot, but how do I go about choosing the best midwife for me?
Well, there are a few things that you will need to...
Important things to look for when choosing the right midwife. What are her credentials? Is she trained and licensed in nursing and midwifery? Does she have a bachelor's degree from an accredited institution? Is she certified by the American College of Nurse Midwives? There are other questions to ask as well, such as, does she attend conferences and workshops to keep her practice current? Also, how many births has she attended as a primary midwife? Be sure to address all concerns that you may have when choosing the correct midwifery.
Looks great. So were you satisfied with your choice to use a midwife?
I was extremely happy.
That's great. I'm glad to hear it. And if you need any postpartum care or any advice on nursing or anything like that, I have great tips and knowledge regarding that as well.
Thank you.
You're welcome.
Are you okay?
No!
Are you okay?
Alright, Yasmin, the ultrasound looked great. Everything's normal. The position of the baby's in a good one.
Myth: if I have a midwife, I have to have my baby in my house.
Myth: oh, see, now
Danielle, you're fine. Quit being dramatic.
Myth: okay. Wait, are you recording?
Yep.
Okay. Myth:
Myth: having a baby is so expensive. Fact: I don't know what I'm gonna say. Hug your Hawaii one more time.
Okay.
Hug your wife and hug your wife.
Shut up, guys! Quiet on the set!
Bitch.